She has come to talk to us about the flu bug. So good morning, Connie.
Hi, good morning. Thank you for having me on.
Absolutely. You know, I want to ask you, most of us think we know what the flu is, but what is the flu?
The flu is a respiratory illness caused by the influenza virus. It can cause you to have either a mild or severe respiratory illness. It can cause hospitalization or even death.
Right.
So it's a pretty serious condition.
And it's not something that you can go to your doctor and get an antibiotic and it's over.
That's correct, because antibiotics do not treat viruses.
Right.
And those who are high risk for the flu are the very young,
right,
pregnant women, those over the age of 65, and I'm approaching that quickly. And patients that have underlying conditions like diabetes,
right,
heart conditions,
right,
or asthma.
Right. And it's important for those people to get the flu shot, isn't it?
It is very important that you get it every year.
Right.
It protects you. It's been shown by CDC estimates that you get a protection of 30 to 60% per season. It's hard to gauge because viruses do change quickly.
Right.
And I think today, CDC, if you go on their website, they're saying that the vaccine's improved each and every year, so they feel like it's a better match this season than it has been. So.
Yeah, I think they're getting it more down to a science as to what it is going to be for that year, right?
That's
or what
right.
Yeah. So, and I said a while ago, probably misspoke because I said those people that have diabetes and heart conditions and young people, but everybody probably needs the flu shot.
Everyone needs the
they?
flu shot, even the healthy individual. Just the ones that I listed are higher risk, but everyone needs to get the flu shot. And it's real important that you get your children immunized and any age. CDC, the flu vaccine is offered from 6 months and older.
Wow.
So as early as 6 months, you should look at getting the flu vaccine.
Now, if you are sick, have a cold already, or if you have had any stomach bug or anything, is it suggested that you get the flu at that time, or should you wait? I mean, not the flu shot. Or should you wait until you're over being ill?
Yes, you should wait. There are those people who should not get the flu vaccine, and if you do feel ill, you should not take it at that time.
Right. Let them know if you get your flu shot that you are sick.
Exactly. So when you're talking to your healthcare provider, let them know how you're feeling.
Right.
And they may say postpone that. People with Guillain-Barré syndrome is also, if you've had a history of that, are recommended not to get the flu shot.
Well, if you've ever had the flu, and knock on wood, I don't think I've ever had it, if you've ever had it, people that have had it say you do not want it.
That's correct. And I have had it, and I thought very young as a teenager, and thought, you know, this is very,
I'm going to die.
Sick. I did think that. I'm going to die.
I'm going to die right here.
Yes. And it was very, very severe. So, you know, it's something you don't want to fool around with.
That's right. Well, what is the hospital doing to prevent the flu spread?
Okay. We're asking the public not to visit during visitor restrictions, and we just implemented that last Thursday, a week ago, on January 3rd. And we began to see flu consistently come into our hospital. So we're seeing the flu more consistently in our community. And so we're asking not to visit if you have symptoms that you feel achy, you think you have a fever coming on, you've got a runny nose or a cough. Just wait until you feel better and come out and see our patients when you're better, if you have loved ones in the hospital. We're also asking under the restrictions that if you have children under the age of 12 that you don't visit our campus because it's safer for them.
Oh, absolutely.
They're small, they put their hands up to their face a lot, and it's just safer until we lift those restrictions. And hopefully, we just began them, but hopefully in a couple months, we may be lifting those. Right now, flu season usually runs from October to March, but CDC says the peak for flu season is February and followed by December.
Wow.
So with us just beginning, we saw the cases started coming in more consistently at the end of December and now to date. And so we're just beginning, so we're looking to see how that might peak in the coming months.
call your loved one. If they're in the hospital, call them on the phone.
Yes.
That would be a lot better.
Yes, call them, send them a card, and I'm glad you said that because we now offer a new service this year,
really?
brand new. It's called a cheer card.
Oh.
So you can go to our internet and look up the cheer card. You actually can order it online.
Right.
It's free,
Oh,
and
wow.
you can actually have it emailed to your loved one or actually ask that it be printed and delivered to their room.
That is neat.
And
That
that's
is so
offered
neat.
by our volunteer service and hospitality service at the hospital.
That is wonderful. Well, how does the flu spread?
Well, it spreads person to person, and it's usually with close contact. It can be, you can actually give the flu to someone just 6 feet away.
Yeah.
And so you want to make sure if somebody has those symptoms that if they're talking to you, if they're coughing or sneezing, it can be spread by droplet. And you can actually pick it up by breathing it in, into your nose, your mouth, even in your eyes. And if you don't have that close contact, but you touch surfaces where people have been with the
Absolutely.
flu virus, you touch that, bring your hand up to your face,
Yeah.
then you possibly can introduce it that
Well,
way.
we touch doorknobs. We
right.
touch everything like that. So, you know, the desk, the chair,
That's
we
right.
touch everything, counter space,
Yeah.
and don't realize that, as you said, those droplets are everywhere. I have a policy, and I can't say what other people's businesses do, but I have a policy. I tell my staff, don't come, don't come. We'll do the best we can
Right, right. And it
without
is,
you, because
That's
stay
right.
home.
That's right. It's safer to stay home and not spread it.
Because then I'm going to have the whole staff out.
Right.
And when they get it.
Yes, it can spread like wildfire.
Yes, absolutely. So, now how long are you contagious with the flu?
CDC says you're on the average, you're contagious 3 to 4 days after you contract the illness, but some people can be contagious up to 7 days. So if you actually become an inpatient in a hospital and you're diagnosed with flu, you may be put on what's called droplet precautions in our hospital for 7 days
Wow.
because of that window. So it can be spread up to 7 days or contagious for that long.
And how long are you carrying it before the symptoms start?
It can be up to 1 to 2 days, but the average is 1 to 4. Some people can carry that symptom or that virus before they develop symptoms as long as 4 days, but usually it's within 1 to 2 days.
Now, what can become complications of the flu?
Yes, you want to make sure that you're taking good care of yourself even if you have the flu. Talking with your provider. Flu complications can mean that they develop an ear infection, sinusitis, bronchitis, or even pneumonia.
Wow.
Those can be serious, especially the pneumonia, of course.
Yeah, pneumonia, you know,
Yes.
that can get to be a threat. I mean, it can be dangerous sometimes, so we don't want that. How can a person prevent getting the flu or spreading it?
The thing that you can do to prevent the flu is get your vaccine. CDC says to have your vaccine by October 31st is ideal. So, you know, those who are really faithful getting your vaccination, you know, should get it in before then. But it's not too late during the flu season. If you haven't had it, you can get it now. You know, check with your provider, your local pharmacy.
Right.
A lot of drugstores offer the flu vaccine. Talk to your pharmacist at the drugstores about getting your vaccine. It's very beneficial, again, for that 6-month older. I do want to note that even pregnant women get the benefit and their unborn child once you get the vaccine. Of course, always consult with your health care provider.
Sure.
But it even protects the unborn infant. Even after delivery, there's benefit of protection from a mother or pregnant mother getting their vaccine.
Wow. Well, how long can it live in the environment?
It can live up to 24 hours in the environment, which is very, I guess, mind-boggling. You think about somebody being present here, and then, you know, 24 hours from now, that virus is still on that surface.
Somebody sneezes,
Yes,
there it
cough.
is, it's there.
That's right, and also if you're coughing or sneezing into a Kleenex, it can live up to 15 minutes in that Kleenex. So
Right.
it's real important that you get rid of that Kleenex, don't put it back in your pocket,
Right.
and get, you know, discard of that.
What do you say to people that say, I'm not getting the flu shot because why would I do that? It gives me the flu.
Yeah, I've heard that a lot. I've had the flu shot for many years, and you know, you do think about that because people have experienced after the flu shot that they didn't feel too good, or maybe they did come down with something. And I will tell you, experts and epidemiologists said that they most likely had the virus going on at the time. You know, you do have healthy individuals that may not even have symptoms for that first day or two.
Right.
They come in and take that flu shot, but it does not give you the flu.
Right.
The most most common reactions that are reported are the local site where you get the injection, just soreness, maybe some swelling or redness for some individuals, but the most common complaint is soreness.
I've never had swelling or redness. I've had, my arm's been sore, but I mean, you know what? I can put up with that sore arm a whole lot more than I can put up with the flu.
Yeah, that's exactly right.
So what? Your arm is sore. And you know, once in a while I've said, you know, I don't feel good, but look at this. Here's a chart right here, some graphics that the hospital sent over
Yeah, a lot of people ask what's the difference between the flu and the cold, and I think the main takeaway is that flu is a sudden, abrupt onset. You suddenly, you feel a headache, you feel those body aches, and with the cold it's gradual. You know, we often say, I feel a cold coming on, so it is truly gradual. And I think when you look at that chart or that table, that fever is rare with cold, and also a headache is rare with a cold. But it, you know, we get those aches sometimes, those chills, that stuffy nose, maybe that runny nose, do a lot of sneezing with a cold, and you can have a sore throat as well sometimes with the flu, but most common with the cold.
That's a little bit of differentiation between the two, if that helps. Hopefully it does, but yeah, it is kind of, you know, you think about sometimes, do I have a cold, do I have the flu? I think if people have the flu, they know it.
Yes.
You'll know it.
You'll know it. Yeah. You feel very fatigued, very weak, and those body aches are very pronounced.
What was the burden of flu disease in 2017, 18, and now?
Okay, last year, the burden of flu for the U.S., CDC estimates about 49 million people were impacted by the flu illness. That's a lot of people. And about 960,000 people were hospitalized with flu. That's an estimate. And 79,000 deaths occurred with the flu. And one thing I'd like to point out on their statistics too, that in the age group of 65 and older, that 50 to 70% of the hospitalizations are in that age group. And then it moves up higher for the mortality or death rate of about 70 to 90% death rate for 65 and older. So it's real important to take care of yourself, that we take care of our seasoned citizens and keep them healthy.
Very good, absolutely. How many patients have y'all approximately seen in the ER or ED? I've always called it ER, but
That's
ED,
right.
I think that's what they call it now.
Either's fine.
But anyway, how many patients have y'all seen with the flu this year?
Well, this year we're probably up to about 70 positive tests. That's not counting all the people come in with thinking, you know, that they had symptoms and were tested and tested negative. So we're a little bit lower on those positive tests that I know of, but we probably average more than that daily, but I just don't have those rates. And one thing I do want to point out, when you asked me about the burden of the flu season and the national rates, but last year for North Carolina, for those institutions that report information into the state, there were over 12,000 positive results last year, and over, 391 deaths in North Carolina alone. And that's very serious. It was a very bad flu year last year. And this year, with just seeing gradual increase in our community, for the state, there have been 10 deaths reported so far in North Carolina. And 2 of those have been in the age group of 25 to 49-year-old, and then 65 and older, there have been 8 deaths in the state thus far. And last year, with those 391 deaths, it was all age ranges. You're talking small children to older adults.
Do we know this year if it's going to be, is there any way to tell if it's going to be a mild year, a medium year, a high year?
Yeah, it's very hard to tell.
Right.
If you look on the website at CDC and you say, what is the peak flu season, you'll see a graph there, and it shows that there has actually been a peak in October, or November, which is very early,
Right.
as long as they've been tracking it and getting this information for 36 years. But the average peak month is February, and with us just starting in our community, it's hard to say, but I would venture that it may be a February, March peak for our community.
Right.
It's just a guess.
Do y'all administer the flu shot at the hospital, or should people go to their provider?
They should go to their provider and
Okay.
get their flu shot, or the drugstore, the local drugstore, and talk to the pharmacist about getting your flu shot, and talk to your doctor. We do offer the flu shot for our inpatients. They come in, if we find
Right.
out, they've not had their vaccine
Right.
yet, it's offered to them. And of course, we immunize or vaccinate our staff. And I'm proud to
Sure.
report that we have 100% vaccine
wow.
compliance for our staff at Nash.
That's great. That is great. I think that's important to get
Yes.
the staff vaccinated. Absolutely. Well, Connie, this has been very informational and informative and
Thank you.
all of that. Thank you so much for coming.
All right, thank you. Thank you for the opportunity.
Absolutely, and I hope now we are well versed in the flu so that if we are getting it, we can, or hopefully we will get the flu shot and be encouraged to get the flu shot. And let's hope that we don't get it. So anyway, we thank Connie for coming this morning.
Well, thank you. And I think they're showing you right now our flu alert sign that you'll see posted in our entryways. So when you come, it's just a reminder to keep patients healthy, and just we're asking if you'll abide by our visitor restrictions. And I do want to say one more thing to Sandra, that some of the things for prevention, we talked about the flu vaccine, we talked about not visiting the sick,
Right.
staying home if you're sick,
Right.
if at all possible, and of course seeking health care if you need that, and that you're very, very sick. But the things you mentioned about disinfecting your items at home, cleaning those most common touched areas, the surfaces, the knobs. I wipe down my phone every day with the alcohol
yes.
swipe. Maybe changing out your toothbrush. Sometimes we don't think about things
That's
like
a
that.
good idea.
That we
That's
can
a very
discard
good
that
idea.
toothbrush, especially at the end of an illness, and
Yes,
start fresh. But do that
absolutely.
routinely. And if you cough or sneeze, that you cover the cough with the tissue,
Absolutely.
throw that
It's
away.
like this, not
Uh-huh.
like this.
But yes, the best practice now is to cough or sneeze in your elbow, the bend of your elbow. We used to teach cough in your hands,
That's
but we
right.
learned we were spreading
Can you
the germs.
imagine? We used
I
to
know,
say that.
I know. That was old school. Now the new school is to cough in the bend of your elbow. And I see young children doing that, so
Oh, yes.
commend parents
I
and
think
teachers
they
for teaching
learned.
that.
They're
Yeah.
learning that. And wash your hands, wash your
Wash
hands.
your hands,
wash your hands.
absolutely.
I mean, you cannot wash your hands enough. I mean, just keep going and washing your hands, because you're constantly touching a phone, a doorknob, something, surface.
That's key. It's number one.
Yes.
And soap and water are good, and the gels, the alcohol gels, are effective as well.
My husband used to tell me, you just wash your hands, you're washing the skin off your hands, because I do wash my hands. When I go in a restaurant, first thing I do is go to the bathroom, wash my hands. When I leave, I wash my hands.
Yeah,
I
good.
wash my hands, and yes, I have to carry a lot of lotion because it does dry your, but
Yeah.
I wash my hands, and
Very good.
that's just a good rule to have.
It
Just
is.
everybody wash your hands. So
And that's one of the things we teach, hand hygiene at the
Yes.
hospital, and there's an art to it. And research has shown that we typically miss our fingertips
Yes.
and the thumb area of our hand.
Yes.
And you want to know how long is adequate hand washing. It's 20 seconds. And so we teach, if you sing the happy birthday song at least
Right.
twice,
I've heard
or the
that.
ABC song to yourself, that's usually about adequate time for good hand washing. Cover all surfaces, and even if you're just doing soap and water, cover those surfaces on your hand. And if you're using gel, cover your fingertips, your thumb, and all surfaces until it's dried in.
And don't feel bad about telling people, we in the South like to shake hands.
Yes, that's
And I
right.
do shake hands. But in the wintertime, I tell people, let's just not, we'll do the, whatever. But people don't mind if you say, right now, everything's going around. I don't know if I've been exposed to something, so
That's
I won't
right.
shake hands right now. But people understand that. They do understand. And so don't shake so many hands.
That's correct, and I have seen some churches,
Yes.
actually promote that during flu season.
That's
that
good.
Not
I think
to
that's
shake
good.
hands.
It doesn't mean we don't love you.
That's exactly
It just
right.
means that we don't
And some businesses
want to get
do.
sick.
That's
So,
right.
Anyway, thank you, Connie. This has
Right.
been very enlightening. Glad to have you on. Always glad to have UNC Nash on with us. So we'll be right back with more, and maybe we can have Connie on another time and to talk about something else.
Great. Thank you, Sandra.